when looking at treating problems of the foot and the ankle, the first thing that we want to look at is the movement available through the ankle complex. So, first of all, at the talocrural joint, we have dorsiflexion and plantar flexion. At the subtalar joint just behind it, we have inversion and eversion. First of all, looking at dorsiflexion, it's really important for us to have at least 10 to 15 degrees of dorsiflexion during the gait cycle. If we don't have that, then it tends to force more pronation through the foot, which can lead to problems of its own. And it also means that you tend to get shock absorption problems through a stiffer ankle, leading to conditions like plantar fasciitis. So, looking at the dorsiflexion available in Chris's ankles, so Chris, if you can just bring your feet up towards you. So, active mobility testing of the ankle, we can see that the right ankle has about 5 to 10 degrees of dorsiflexion compared to the left, which is less, 0 to 5. And relax there, that's great. So it's important for us to treat and improve the amount of dorsiflexion in this ankle, which will help treat the mobility issue and also relate to potentially a number of conditions that may develop. So, thinking about treating dorsiflexion, we want to consider the two fascial compartments that control it. First of all, the anterior compartment that needs to glide upwards when the ankle dorsiflexes, and the posterior calf compartment that needs to stretch out. So first of all, looking at how well these tissues at the front glide. One of the important ones is the extensor retinaculum. So let's look at treating that. So I'm going to bring a nice broad loose contact over the extensor retinaculum. Chris, if you can just bring your toes up towards you and then slowly glide your toes down towards the floor. So effectively an active soft tissue release. And keep going. Just reminding ourselves that the retinaculum is a broad superficial strap of tissue that houses the tendons in underneath, so we don't need a really deep contact. That's good. A little bit more. Keep going. And relax, that's great. And we'll just do that once more. So bringing the foot up towards you, good. And then slowly bringing the toes of the foot down towards the floor. I can also work over the retinaculum with contact like knuckles, so actually just encouraging the ankle to dorsiflex as I move and get those tissues gliding superiorly. I can actually do a little bit of work on the calf muscles in this position, better done in prone, but actually thinking about, getting underneath muscles like soleus and encouraging, so contact with the finger pads underneath and encouraging the ankle to dorsiflex. So effectively encouraging lengthening of the posterior chain, the calf muscles, and superior gliding of the anterior chain, extensor retinaculum, tibialis anterior. So let's just have a quick look at that again and say, Chris, if you can just flex your ankles again up towards you, and you see that still not quite as much as the right, but it's actually dorsiflexing now better on the left, which will help during gait and be very helpful in treating common conditions, plantar fasciitis, probably the most common.